Contract with Osler. Osler's nodes are red, firm, sensitive bumps on the tips of the fingers and toes that have definite borders. Important details of the Osler agreement. The following is important information about the Osler contract. There is pain in the area before Osler's nodes arise, and this discomfort indicates that Osler's nodes will appear later. These nodes develop as a result of an infection in the small blood arteries in the fingers, and they are most commonly seen in cases of subacute bacterial endocarditis. The number of nodes might vary from a single node to a huge number of nodes. Endocarditis is a dangerous disease that can affect many organs and systems in the human body, and Osler's nodes are one of the most common signs. Patients may not have any symptoms as a result of the existence of Osler nodes in the majority of cases, but in rare cases, the patient may experience fever and excessive sweating. Osler's nodules develop on the palms, fingers, and toes as a result of an infection caused by inflammation of small blood vessel walls. These nodules are red or purple in hue, convex, and pea-sized or somewhat smaller. Osler's nodes can be unpleasant at times, and they grow and vanish on their own. It is important to note that these nodes are not diseases in and of themselves. Osler's contract symptoms. The Osler nodule is one of the most common symptoms of subacute endocarditis, and it is often accompanied by additional signs and symptoms, such as anxiety, weakness in general, fever, goosebumps, excessive sweating, muscle and joint discomfort, loss of weight, a change in the skin's hue, which might turn gray or yellow. There is a rash on the mucous membranes. Osler's contract causes and risk factors. The following are some of the key observations on the causes and factors that led to Osler's contract injury. Osler's nodes infection is caused by endocarditis, which can be caused by a bacterial, fungal, or viral infection. There are a variety of circumstances that enhance the risk of endocarditis and hence Osler's contract, including the following. 1. Respiratory illnesses caused by infectious agents. Rheumatology is the second specialty. 3. Gum disease. Tonsillitis is number 4. Tuberculosis, TB. Catheterization of the urethra. 7. Extraction of teeth. Intravenous catheters, 4 catheters. 9. Pacemakers are used. 10. Heart defects of various types. Surgery is number 11. 12. Lupus erythematosus systemic. Osler's nodes are usually indicative of subacute bacterial endocarditis, as they appear in 10 to 25% of patients with endocarditis. The Osler contract's complications. Endocarditis can lead to a variety of problems, including the following. Heart problems. Failure of different body organs, including the brain, lungs, stomach organs, kidneys, limbs, and legs. The heart valve is damaged. Heart function problems. A stroke of the brain. Abscesses, pockets of collected pus, that occur in the heart, brain, lungs, and other organs. A pulmonary embolism is a blood clot that forms in the pulmonary artery. Kidney function impairment. Spleen enlargement. Contract diagnosis via Osler. The following are some of the key points to consider when diagnosing Osler's contract. The majority of the time, the ailment is identified based on the patient's clinical symptoms and skin appearances. Infectious endocarditis causes Osler's nodes in 40 to 90% of patients. Early detection and treatment of infective endocarditis is critical for preventing complications and mortality. Not therapy by Osler. The following medications are used to treat endocarditis and Osler's nodes. 1. Pharmaceuticals. The following are some key points to remember when it comes to drug treatment. The treatment you receive is determined by the cause of your endocarditis. Bacterial endocarditis is treated with high doses of intravenous antibiotics, and the treatment usually lasts a week or more. If endocarditis is caused by a fungus, the doctor will prescribe antifungal medicine, and some individuals will need to take antifungal medication for the rest of their lives to avoid getting endocarditis again. 2. Surgical procedures. Surgery to cure persistent endocarditis or replace a damaged valve, as well as surgery to treat fungal infections, may be required. Osler's knot prevention. Some techniques, such as the ones listed below, can help avoid endocarditis and hence Osler's contract. It is critical to be aware of the signs and symptoms of endocarditis, and to get medical help right away if any of them develop, such as a persistent fever, exhaustion from an unknown source, any form of skin infection, open wounds, or ulcers that do not heal properly. Maintain the health of your teeth and gums by brushing and flossing them regularly and seeing a dentist on a regular basis. Do not take illegal drugs intravenously. Infected needles spread bacteria throughout the body, increasing the risk of endocarditis. In some circumstances, taking prophylactic antibiotics after consulting with a doctor. 1. An endocarditis history. 2. An prosthetic heart valve is implanted. 3. Transplantation of the heart. 4. Infection in people who have specific forms of congenital cardiac disease. 5. Had surgery in the last 6 months to treat congenital heart problems.